Hi, it's Congresswoman Jan Schakowsky. I'm back with my plans and pans. This week, Democratic congressional members from the House of Representatives held roundtables and all different kinds of events for the Gun Violence Day of Action. I had an incredible gathering of about 25 people at a roundtable at a local library, and it included a number of students from various high schools, from Glenbrook South, from New Trier, from Maine West high schools. Some of these were activists when it comes to organizing in their high schools to end gun violence, to discuss the strategies to do so, and some just came for more information. Also, Moms Demand Action, an incredible organization that focuses on advocacy against gun violence all around the country. And in Illinois and in our community, we have the tremendous work that they are doing to fight for legislation at the state and the federal level. State Representative Jen Gershowitz was also at this to talk about the state fighting right now to get a ban on assault weapons, just as the House of Representatives did. We passed such a bill, but it has not gone through the Senate yet. I learned, I think, in a new way, the kind of fear that and anxiety that young people in particular feel. And I want to read you a quote from a letter that a girl who was at the event handed to me, and it really touched my heart. In an effort to keep me and my siblings safe at school, my parents purchased bulletproof backpacks. It would be so nice not to have that extra weight on me, both the fear of a shooting and the weight of a bulletproof backpack. This is what our kids are facing. There are lockdowns that happen at school. There are all kinds of training that they have if there's an active shooter in the building. And it occurred to me that this is really a new phenomenon that's happening now in schools across the country. And it is a burden that our students are feeling, it really came to light during this roundtable. But we also had a lot of hope at that meeting because as I pointed out and others discussed, we have made progress. That even though no gun legislation, no gun safety legislation was passed for 3 decades, we have passed legislation in the Congress, and we plan to do more. And the only reason we did isn't because legislators suddenly saw the light that we had to do something about this crisis. No, it's because the politics changed. They realized it wasn't good politics to vote against gun safety legislation. And so we expect to make more progress, and that the activists in the schools and the organizations like Moms Demand Action will continue to fight and continue to make progress. But one of the things that we talked about, for example, we do have to have an assault weapons ban that is passed at the federal and the state levels. We should have universal background checks. We still don't have them. There should be safe storage of guns that are in the homes, and we ought to raise the age universally to at least 21 to be able to purchase a gun. Federal law says in order to buy a handgun, you have to be from a licensed dealer. You have to be 21 years old. To buy a long gun, which would include an AR-15, which is an automatic weapon, you only have to be 18 years old to buy that from a licensed dealer. So clearly, we have to raise the age at minimum, and of course, the best would be just to ban those weapons of mass destruction. Also this week, I had a really delightful visit about childcare that was sponsored by the JCC, Jewish Community Center's Chicago Early Childhood Collaborative. And the setting, there's 7 of them around the state, but the setting that we went to was at Beth Emmet Synagogue, which happens to be my synagogue here in Evanston, Illinois. They have an absolutely fabulous program that starts with infants and goes up to 4-year-olds. One of the things that I learned, and they pointed out, is that 26.8 million people, that's about 16% of U.S. workforce, relies on child care to be able to take care of their children. But we also know that for many people, it is simply not accessible. 1, there may not be enough quality child care, and 2, the cost. In Illinois, more than 250,000 children are not able to access quality child care. It's either not available or way too expensive. 40% of parents report that they go into debt in order to pay for child care. Certainly here in the United States, we should be able to do better. Our workforce depends on it, families depend on it, and we have to make it accessible and affordable. Last Wednesday, a federal judge in Texas made, don't be surprised, a really, I believe, bad decision. What the ruling said was that the government cannot mandate employers to provide drugs that prevent HIV/AIDS infections. Now, the reason that they gave was that the ruling, the original ruling violated the religious freedom of employers. And unfortunately, what we think is that it began now to set the stage for other kinds of not providing preventive care, and that would include all kinds of sexual and reproductive rights and things like birth control. So we're afraid that many of the more extremists will be pushing for that kind of decision in the courts, and if it goes to the Supreme Court, who knows what those decisions will be. And that would affect, that ruling, that type of ruling would affect 150 million workers who are on their employers' health care plans. And so this would could be the beginning. It's a bad enough decision on its own to not help prevent HIV/AIDS, but we don't want to see it go, certainly don't want to see it go any further, and we need to overturn that. And then let me tell you about COVID. I have a couple things after that too. So there are no new booster shots that are available right now and being offered in Chicago and elsewhere, pretty much everywhere, that would be only for people who have already had previous shots. And so you want to find out, they should be free and available, and it's certainly recommended that you go out. I'm hoping to very soon get that shot. And I know my husband is looking forward to that as well. In the past 6 weeks, 36% of the people who have been reinfected are people who earlier did have Omicron infections. So again, it's important to get that booster shot if you can. In Illinois this week, 2,656 new cases of COVID and 18 deaths as of last Wednesday. So just to wrap up, let me say that Sunday marks the 21st anniversary, how time flies, of the September 11th attack that killed thousands of Americans in the United States. This vicious attack that took place. I also wanted to acknowledge the death of Queen Elizabeth II, the longest serving monarch that we have seen, 7 decades long, and to send condolences to the royal family and all those who mourn her loss. Finally, let me just point out that the election, the general election that will take place on November 8th is now less than 2 months away, and just want to remind everybody to register to vote. This is the most precious power that we have as individuals in this democracy. So please don't miss the chance and be sure and sign up to vote. So thank you. I will see you next week. Bye. Thank you for watching my video. Make sure you subscribe to my YouTube channel and follow me on Instagram, Twitter, and Facebook, where my handle is @Jan Schakowsky.